Be going over preventing injuries through fitness training. First, we need to go over some important fitness definitions. One really important concept in fitness is periodization, and this means training in cycles. So ideally, you wouldn't do the same 6 exercises every single time you work out for the rest of your life. Ideally, we would train in cycles. So for athletes, they're going to train based on their competitive season, but for other people that might be different. But basically, periodization reduces the risk of injury and overtraining. It also improves performance. For athletes, usually periodization goes in a 1-year cycle, but if the athlete is training for an Olympics sport or an Olympic year, then it might be a 4-year cycle. Say, for instance, at University of Michigan, when I was there, we had a couple of athletes, including Michael Phelps, swimming, that were training for the Olympics, and they actually had a countdown clock on the wall for the Olympics. It was very interesting. So when we talked about periodization, we said that reduces the risk of overtraining. So overtraining is something that can occur that can negatively affect strength and performance. And it's basically a state where somebody is doing something too much for too long and they get worn out, essentially. We'll talk about that more in a later lecture. Another very important fitness definition is the SAID principle. SAID stands for Specific Adaptation to Impose Demands. It basically means that the body adapts to the demands placed on it over time. The SAID principle states that training is very specific, and if we're only training certain muscles or body systems, then only those muscles or body systems will adapt. What that means is that if I only ever did bicep curls in the gym, and I'm going to do bicep curls, bicep curls, bicep curls, it's not going to train my triceps to be bigger. So my biceps might get really big, but my triceps would stay the same size. Training my biceps won't affect my tricep strength if I'm not training them as well. If I'm a cyclist and I'm training cycling a lot, and then I try to go swim in the pool, well, I might have some cardio adaptations that could make a bigger difference than somebody that was totally untrained. It really won't make me an elite level swimmer, even if I'm an elite level cyclist, because I'm just not training my arms as much. So this graphic here shows us a good idea of what periodization is. So this is pretty important. We have 3 different seasons for periodization. So these are different times of the year according to the athlete's competitive season. So we have off-season, preseason, and in-season. So oftentimes I'll use football just because it's something I'm used to their seasonal timelines for the most part. So for football, in season is primarily fall. Occasionally, if a team goes to playoffs or something like that, they'll play up into January or so, but usually it's fall. So that's their in season, that's their competition period. And then we'll have the types of training activities that they would be doing during that time. So for in season for football, that would be fall time. They're going to have high intensity, low volume strength training, strength and conditioning. So what that means is that they're going to keep their number of repetitions lower, but keep their weight relatively the same as they were doing in their preseason. So they're not going to drop their weight a ton, but they are going to drop their overall load of training for strength and conditioning. In season for a sport is meant to do conditioning to maintain what they've gained in their off season and preseason. And primarily they're going to be working on their skill training and strategy. So they'll be doing mostly skill training in football practice. Then when it comes to after the season is done, so maybe starting around December or so, or probably for most of the teams, it'll be in January. For football, in January, they will start off-season sports. So they'll have a transition period, which is usually a couple of weeks, like maybe 2 weeks, that they call their postseason also. So transition period, postseason, um, where they'll do unstructured or recreational activities. So that's usually, maybe over Christmas break or something where they're not expected to necessarily be doing a lot of football type work. Or maybe at the very end, after their last game of the season, they'll be doing, more just fun things like they could go surfing or play ultimate frisbee as long as they don't do something that they're likely to get injured doing. This is more of a time to recuperate from the season, do something fun, and get their head straight. Next, in the off season, we'll have the preparatory period. We have 2 phases in the preparatory period. During the preparatory period, the individuals are going to be doing cross training, so they're not going to be doing a lot of football-related activities necessarily, but they are going to be doing a lot of strength and conditioning. So in the first part of that preparatory period, they're going to be entering their hypertrophy and endurance phase. So they're going to be doing lower intensity and higher volume. So their weights are going to be relatively lower compared to in their preseason and in-season, but they're going to be doing more repetitions. This is pretty non-sport specific, so it's really just building the base, trying to rebuild the base after they've taken a little time off and after their body's gotten beaten up from season. So that's our hypertrophy and endurance phase. Next, they're going to enter the strength phase. So here they're doing more moderate intensity and moderate volume. So low intensity and high volume may be, an appropriate weight for doing 3 sets of 15, say for instance. That's a very high volume. So if they're doing, I don't know, squats, 150 pounds, three sets for 15 repetitions, that could be a lower intensity or higher volume for a football player. I'm totally making this up because I don't really know as far as the really big guys what they're lifting, but a moderate intensity and moderate volume might be something like 180 to 200 pounds at possibly for moderate volume, maybe 3 sets of 10 or 3 sets of 8 instead, or maybe 2 sets of 10. So those are going to be more moderate numbers compared to the low intensity, high volume example. Then so that would be more springtime, maybe even a little bit into summer. But as we hit the preseason time, that's going to be most of summer. And this is going to be our power phase. So this is where they're really wanting to build up speed of movement, become more sport specific with their strength and conditioning. They're going to be doing higher intensity and decreased volume. So instead of doing, for squat, they may be doing 225 pounds, but with maybe 2 sets of 5 or something. And they may be doing more Olympic lifts that are more explosive, things like that. They may be doing more sprints and other types of things for conditioning. This will be more sport specific. It will be more like things you would see somebody doing on the field, or more specific to their position. So that's preseason, and then we come back to in season, where they're keeping the high intensity, so maybe keeping higher weights, but then doing low volume overall. Another important aspect of fitness is doing a proper warm up and cool down. So a lot of people think that warming up and cooling down isn't super important. If they're short on time, they don't do this. But with the warm up, you're increasing your body temperature. You're also increasing your ligament elasticity and your flexibility. For doing a warm up, it should last 10 to 15 minutes and cause a light sweat. We can use a general warm-up like jogging for a few minutes and then do some dynamic stretching and then move into a more specific warm-up. For soccer, that would be like passing drills. Cool down is also important, especially after a hard effort. So especially after a full sprint, cooling down is important. If somebody's doing a full sprint and then they just stop, their blood tends to pool in their legs and they could pass out. So the cool down is really important for returning blood to the heart from the limbs. The cool down should last for about 5 to 10 minutes. Flexibility is very important for dynamic activities because a muscle at proper length releases more elastic energy than a muscle at an improper length. So if a muscle is too short or too elongated, then the muscle is not going to release the best amount of elastic energy. Basically, with flexibility, we're trying to take advantage of having as many myosin and actin bridges as we can with the muscle fiber. If a muscle is too short or too long, it actually reduces the number of connections we have when it comes to the myosin and actin bridges that will cause a contraction. Flexibility can also prevent chronic and sometimes acute injuries, but probably not muscle strains. So doing static stretching prior to activity is not going to help reduce the risk of muscle strains, but doing static stretching after activity or at a separate time can help reduce chronic injuries like chronic knee pain and back injuries, things like that. Flexibility is affected by joint structure, the muscle and tendon tightness, ligaments and joint capsules. So the ligaments and joint capsules are going to affect flexibility in the joint, particularly after surgery. However, too much flexibility can predispose an athlete to injuries also. We really want a balance between strength and flexibility. So if we have an athlete or a client who is very flexible, they also need to be very strong. And if we have a client who's very strong, we usually need to increase their flexibility. So this slide is an interesting example of flexibility. Here we're seeing an example of a back bend. So for these two individuals, probably one of the more interesting things about these two individuals is that the male is actually more flexible than the female. Generally speaking, women tend to be a little bit more flexible than men. But we see this in a couple different ways here. So her hip here in the front is a little flatter when she goes into that back bend. He's actually got more of a curve here. So she is tighter with her muscles in the front of her hip than he is. That's one way she's tighter. Another way is she's tighter in her shoulders. So if we look at her shoulder girdle here, her angle here is a little bit more, probably not quite that severe, but a little more severe than his is. He's a little straighter through here than she is. So that's showing us that she's probably got a tighter joint capsule in her shoulder, and the musculature in her shoulders is also tighter. Another spot that we're seeing that she's tighter is in her forearms. So coming through here, coming through the forearms, she has a lot more curvature as she's coming through that wrist extension. He's actually pretty darn straight here, and then he goes into that wrist extension. So she's trying to gain that motion with her elbow. He already has it. He's totally straight there. So that's kind of interesting. So that's probably the wrist joint capsules, and also the forearm muscles, and also the elbow joint are probably more flexible on the male. The other interesting thing we're seeing here is that the vertebral joints don't extend as well with the female. So her back is just flatter. So she's really only got one spot where she kind of right in here where she gets her extension. It's not the whole way through. He's really got a lot of motion in that area, like more than she does. So right through here, he's got a lot of motion. So that's kind of interesting as well. So that's because her vertebral joints are not extending as much as his do. So that's kind of an example of how those different areas would affect flexibility. As far as important stretching terms to be aware of, we have our active range of motion. So this is measured in degrees, as is passive range of motion. But active range of motion is the amount of motion that the athlete or client can move a joint without resistance, or without assistance, excuse me. So if the athlete is bringing their own arm up through the air as far as they can, that's active range of motion. Passive range of motion, or PROM, is the amount of motion the athlete or client can move the joint with assistance. So if we're raising their arm up, we're going to be able to usually raise them farther than they can go themselves, because when they're doing the active range of motion, it depends on their amount of flexibility of their joint, but also how strong their muscles are at the extreme of motion. When we're doing passive range of motion, we're able to get them to relax more and can often move the joint farther than they can by themselves. When we're talking about ranges of motion, we're going to be talking about agonists and antagonists. So the agonist muscle is a primary mover. If somebody is raising their arm up, then the agonist is likely to be the deltoid. An antagonistic muscle could be the tricep. If you're raising your arm straight forward, the antagonistic muscle would be the tricep because it's working against the primary mover as the deltoid. There are a few ways we can assess flexibility, and they're primarily based on what our setting that we're working in is. So for fitness, you would be more likely to use standardized testing, like a sit and reach. So there are some sit and reach boxes over in the fitness center in the J building. Another way we can measure, so that's the sit and reach box is down here. That's a picture of the sit and reach box. Another way we could measure flexibility would be with shoulder extension testing. So we can do that by having the person lay down flat on their belly with their head resting down, put their hands up over their head, and then raise up towards the sky as far as they can. And then you measure the distance that they go. Another way you could do that would be another standard testing for flexibility is trunk extension. So that would be pretty much the same idea, face down, head down, and then they raise their trunk as far as they can, and then you measure from the ground to their forehead, say for instance. So that would be trunk extension, or from their ground to their chest. In rehabilitation, we use active range of motion and or passive range of motion assessment for injured nearby, the injured joint and in nearby joints often. So say, for instance, if somebody injured their knee, we would use this goniometer in this picture. So we use these lines here to tell us what their degrees of motion are. So we use the line that goes on the femur, the stationary arm, and then the line that goes on the tibia, the moving arm, to tell us what position their joint is in. So this would be about 90 degrees of motion. This joint angle here would be about 90 degrees of motion. And we use that to assess how much motion they've lost, and we can compare bilaterally, or we can compare to a norm for that joint, and we do have norms for each joint for those ranges of motion. I most often test passive range of motion if I'm going to do that, but sometimes active range of motion is more appropriate. I also, generally speaking, only use the goniometer, the actual specific measurement, when somebody has had surgery and we're treating them post-operatively. That's more common. Otherwise, we might say, they're lacking an estimated 10 degrees of motion or something like that, instead of actually measuring it with the goniometer. At the physical therapy clinic I work at, we do percentages of normal, basically. So the person has 50% of normal as far as forward flexion of the trunk. So we have a few different types of stretching. All of these types of stretching will work and will increase a client's or patient's flexibility. Some increase that flexibility more than others, and they all have their benefits and drawbacks. So our first is ballistic stretching. Ballistic stretching is not used a ton in the US. It's used a bit more overseas. But basically with ballistic stretching, you're going to reach, say for instance, for a ballistic hamstring stretch, you will reach down towards the ground to try to touch your toes, and you will bounce and reach farther and farther each time doing that repetitively. It does work. It will gain somebody range of motion, but it can also cause soreness or strains. So we don't use that as much here in the US. Something we do use a lot now is called dynamic stretching. This is best used before a workout. And with dynamic stretching, basically we're using functional movements to go through a large range of motion, a large active range of motion. So dynamic hamstring stretch would be something like swinging your leg upright toward the sky while you're trying to reach out to touch your toes with your reach out your hands and trying to touch them with your toes. So you would kick moving forward as you walk. So we're using the action of an antagonist to cause an agonist to stretch. So in the case of doing that marching with the kicking the legs forward, we're using the hip flexors, the action of the hip flexors to get the hamstrings to stretch. A couple of other types of stretching are static stretching and PNF stretching. Static stretching is best done after activity. We don't get as much of a benefit from doing static stretching prior to activity, primarily because you're just really not that warmed up. Even if you do your warm up beforehand, then you sit down and you do your static stretch. Well, I mean, I guess you're kind of warmed up. You're not as warmed up as you're going to be after practice. But the other drawback of doing it that way is that if you warm up and then do your static stretch, by the time you're done with your static stretch, you've lost most of the increase in body temperature that you got from doing your warm-up in the first place. So you go into playing a little bit colder than you would have if you had just done a dynamic stretch. And with static stretching, we're going to use gravity or a partner to move through a passive range of motion. So for a hamstring stretch, this would be something like bending down to touch your toes and holding it for 20 to 30 seconds. So we're going to stretch and hold 2 to 4 sets of 20 to 30 seconds. We want to do it for that long because for a static stretch, we really need the 20 seconds to take advantage of the receptors in the tendons to relax. They really don't relax before that 20 seconds enough to get a really full stretch. We also tend to use static stretching in early rehab and with healthy athletes. PNF stretching is a very effective type of stretching. It could be the most effective depending on the individual you're working with. We can use PNF stretching in mid to late rehab and with healthy athletes. There are 3 different kinds of PNF stretching and all use what we call a stretch, contract, stretch. So with PNF stretching for the hamstring, you guys will be able to, you will get an opportunity to practice this in lab. You'll have your partner lay on their back. They'll bring their leg up straight as far as they can to stretch the hamstring, and then you'll assist them with a little bit more stretch. You'll hold it for a couple seconds, then you'll have them push towards the ground with their legs straight, like they're trying to lower their whole leg to the ground for a couple seconds. That's the contract part. And then you'll take them back into a stretch for a couple seconds, and then you'll repeat the pattern a couple times. So it's a way to use our sensors in our muscles and tendons to relax more completely, basically. So on this slide, we have an example of a dynamic and a static stretch that are both very similar. So for the dynamic stretch, this would be the inchworm. So say, for instance, if the individual starts off in this plank position, they're then going to walk their feet towards their hands to slowly stretch their hamstrings and their back and maybe their shoulders a little bit and their calves. Then if we look at the static stretch here, that would be a down dog stretch. So a very similar stretch, and we're going to have the person stretching their calves down here, their hamstrings and their back up here, and then the shoulders through this region on a static position. So the down dog stretch is likely to gain that individual more range of motion, but it's less appropriate for prior to activity. For PNF stretching, we most commonly use what we call the hold relax technique. So that might be abbreviated PNF-HR. So for the hamstring, in this slide on the bottom on the left, we're going to stretch the person through their full range of motion, like that individual is right there. And then the person who is being stretched will push against the partner. So they'll push in the downward motion that is indicated by this arrow. Then after that, the partner will take them back through full range of motion, and then they'll repeat. So they're going to repeat for 4 stretches and 3 pushes. You want to hold each stretch and each push for 6 to 10 seconds. So that first one is the example of the hamstring. This is an example of a hip flexor stretch. That is actually appropriate positioning both for the hamstring and hip flexor stretch. This is an example of a quad stretch, but not an example of appropriate positioning. You really shouldn't straddle your clients or patients. That's not appropriate. So even if the individual wanted to use his knee under the patient's thigh right here, he shouldn't have this leg over the top of them. That's inappropriate. If somebody walked by, that would not look appropriate, and that could cause some question as to how professional that individual is. So don't straddle your clients or patients, please. Don't be that guy. For strength training, we have 3 main concepts with strength training. We have muscular power, as far as activities that you could do for strength training in addition to the system that we would be training there as far as power. We have muscular strength, and we have muscular endurance. So muscular power is an activity that is very quick. Muscular strength is somewhat quick, and muscular endurance lasts longer. And that's how we take advantage of the different systems that we're trying to train. With muscular power, we're going to have a large amount of force generated quickly. These are activities lasting 10 seconds or less, and we'll do sets of 1 to 5 repetitions. So that would be something along the lines of doing a clean and jerk like we are right here. That's a very quick movement. Muscular strength would be quick. So the muscular strength is the ability of a muscle to generate force against resistance. This would be for an activity lasting 15 to 30 seconds. Muscular endurance lasts longer. So this would be an ability to perform repetitive contractions. So these are activities lasting longer than 60 seconds. So with muscular strength, you may be doing a weight appropriate for you to do 3 sets of 8 repetitions. For muscular endurance, it would probably be more like 3 sets of 10 to 15 repetitions, or maybe it's just a set of 20 repetitions. In rehab, it's not uncommon to do sets of 20 repetitions because we can actually still get some components of muscular strength, and we can get that muscular endurance involved as well. And the weight that's appropriate to complete that repetition is actually slightly easier on the joints. So sometimes sets of 20 repetitions are actually preferable in rehab. As far as the individual lifting this amount of weight, I don't know if he actually lifted that amount of weight, but if we had to guess what kind of activity he was doing there, he's probably doing way too much weight to actually be doing a power exercise. So most likely if he actually is able to squat that amount of weight, he's doing a muscular strength exercise. We have a few different determinants of strength. So a determinant of strength is basically what determines how strong you are as an individual. So each of these determinants can be genetic and or trainable. Our number of muscle fibers we are born with is genetic. We have the number of muscle fibers that we're going to have when we're born. Our number of slow twitch versus fast twitch, though, that's genetic and trainable. So we have actually 3 different kinds of muscle fibers within our individual muscles. We have slow twitch muscles, which are sometimes called oxidative. We have our fast twitch muscles that are called fast glycolytic sometimes. And then we also have a separate type of muscle fiber that kind of looks like both. That's it's an oxidative glycolytic type fiber. So we have those 3 types. The number of slow twitch fibers you're born with. The number of fast twitch fibers you have, you're born with. But it's that 3rd type of fiber that we can actually train with training. So if you look at somebody who's tall and thin, you might say that person is born to be a marathon runner. And then you look at somebody who's very mesomorphic, very muscular, kind of stocky, you would look at that person and say that person's probably not born to be a marathoner. They're probably born to be a weightlifter. But if that stocky person wanted to run a marathon, they probably could. They just have to train for it, and they could change some of those oxidative glycolytic fibers into more of the slow twitch fibers. If the marathoner looking person who's tall and skinny wanted to train to do strength training, could they? Yes. Would they be the best weightlifter ever? Maybe not, but they could get pretty good if they're training those oxidative glycolytic fibers to work more as fast twitch fibers. Another determinant of strength that's genetic and trainable would be biomechanical factors. So as far as that goes, we all have certain positions for our muscle attachments on the bone that are possibly slightly different than the person sitting next to us. So if our distal bicep tendon attaches closer to our elbow, then that's actually not a mechanical advantage. If it attaches slightly farther away from our elbow, that is a mechanical advantage that would help us to be stronger with a bicep curl. That's genetic. That's the way we're born. We can't change that. But if we have a very tight tricep and we're not able to bend our elbow all the way, that makes it so that our bicep is fighting our tricep the entire time we're trying to do a bicep curl. If we stretch that tricep to get more range of motion, that's trainable. We can fix that biomechanical factor so that the bicep is no longer having to fight against the limited joint motion. Size of the muscle is highly trainable. If we work out and we work out with a load that's challenging for the muscle will hypertrophy. It will increase in size over time. If we stop working out, or if we have a surgery, say for instance, and can no longer use that body part normally, we will see muscle atrophy. Unfortunately, the muscle atrophy happens very quickly. The hypertrophy takes a little while to get back. A lot of times we can actually see muscle atrophy even years later in a limb that has had surgery. Our neuromuscular efficiency is another determinant of strength, and that is also highly trainable. Any changes we see in the first 2 to 4 weeks of training, we can attribute it to neuromuscular efficiency. Basically, the neural pathways that go from our brain to our muscles get trained when we're doing an activity. So anytime we're doing a novel activity and we're getting stronger at it, it's because of that training. We're building more neural pathways to learn that activity, basically, and that will make us stronger in the very beginning. After a month or 2 months is when we start to see the hypertrophy. We have a few types of muscle contraction. So this is another important concept in strength or in fitness training. We have an isometric contraction. So in that type of contraction, our muscle does not change length during the contraction. So if I were to try to, I'm a small person, if I were to try to lift something that weighed 300 pounds, no matter how hard I tried to curl my biceps up while I was trying to lift that 300-pound object, the object wouldn't move. So my muscle wouldn't change length. That would be an isometric contraction for me. A concentric contraction is when a muscle is shortened during a contraction. So if we were to curl the arm up, this bicep would get shorter, and that would be the concentric part of the contraction, say for instance with the bicep curl. If you go to lower the arm in a bicep curl like that, then you get a lengthening of the bicep fibers. And in that lengthening, we actually build the most strength. So it's very important to concentrate on the lengthening and not just the eccentric part of the contraction and not just the concentric part of the contraction when we're exercising. So different than the types of muscle contraction, we have types of resistance training exercises. So some of these, one of these actually sounds the same. We do have isometric training exercises, and that would be an exercise that uses isometric contractions. And we'll go over all of these for the most part a little bit more later. And we have progressive resistance exercises, or PREs. We have an isokinetic type of exercise where the force is constant. So normally if we're doing a strength training machine in the gym, when we go to extend our leg on leg extensions, as we move, the force on the leg actually changes because the gravity on the weight stack changes. The gravity on the resistance that is felt by our leg changes as the weight stack goes up and down. But with an isokinetic machine, such as this is a Biodex, the force is actually constant. So this little pivot point right there and the machine that's attached to it actually is able to keep the force constant on that limb. Mostly we use the isokinetic machines in rehab and research. They're very expensive and they're complicated to set up, so you don't usually use those as much in fitness training. We also have circuit training, plyometrics, and calisthenics and functional training. No matter what type of exercise we're doing, the muscle has to be overloaded to gain strength. So we can gain strength with all of these types of exercises. We just need to make sure that we are overloading the muscle. With isometric exercises, we are using a maximal contraction performed against an immovable object. So this would be like me trying to lift the 300-pound object, possibly. We can also use it for early rehab by having an individual who can't tolerate moving through a motion with resistance push against a wall, say for instance, with moderate to maximal contraction in a couple of different positions, but not moving through that contraction. So they might push, like in this example, inward against the wall with the forearm to help with internal rotation of the shoulder. And she would push maybe for 5 to 10 seconds. And then she could switch sides and do external rotation by pushing outward against the wall. So the good thing about this is that you do get good strength gains. The bad thing about it is that you only get strength gains in one position. We are going to use this in early rehab for people who can't tolerate moving a resistance through a range of motion. So progressive resistance exercises are exercises that we use most commonly in weight rooms and with fitness-based training. We can use free weights or machines, and they both have benefits and drawbacks. Machines may be safer for untrained individuals because we're not needing that person to have as much stability and core strength, and people who are untrained tend to not have those things. But machines may not fit very short or very tall people well, or little kids. On our machines at the physical therapy clinic I work at, if a patient is under 5'2", they don't fit really well into most of the machines. Free weights are good because they do require stability and good core strength, so they are going to train those areas a bit. But at the same time, if you have a patient over a certain age and they aren't used to using free weights, it may not be as good of an option as using a machine. So this particular picture is showing my good friend over here doing a very nice squat. I like his positioning with his legs. And he is using free weights for that squat as opposed to using a leg press, say for instance. That would be another option for machine exercise. So a squat is a good example of a closed chain or weight-bearing exercise. An open chain or non-weight bearing exercise would be an example, an example of that would be a leg curl. So those are both lower extremity exercises. One is a closed chain, one is open chain. Leg press, while your feet are not on the floor, you are still bearing the weight of the weight stack. So that with the feet, so that is still considered a closed chain exercise. So leg curl, the feet are not touching anything in particular. They're free floating. That's an open chain exercise. As far as PREs go, we want to use concentric and eccentric contractions, or we will use those, whether or not we want to, if we're doing the exercise properly. Our ratio should be 1 to 2. So as we are curling up, that's going to take account of about 1, 2. And then as we are lowering down into a straighter position, that's going to be a count of 1, 2, 3, 4. So we always want to focus more on the eccentric contraction than the concentric contraction. We want to focus on the lowering or the returning position, or returning to start position. Partially that's because we can build the most strength there, and partially that's because if we don't focus on it and don't slow the movement down, we won't do anything in that motion. The weight will just kind of flop down and we don't get that strength gain at all. Again, for muscular strength, we're looking at 3 sets of 6 to 8 repetitions. And for muscular endurance, we're looking at 3 sets of 10 to 15 repetitions, or we could even do 1 single set of 20 repetitions, possibly in a rehab setting. For muscular strength training, if we're doing appropriate weight to fatigue at 6 to 8 repetitions, we want to make sure that we have a 60 to 90 second rest between sets, because that allows our muscles to replenish their energy systems so that we can adequately perform the following repetition or the following sets. For muscular endurance, we only need a 30 to 60 second rest between sets because that system is a bit more efficient with replenishing the fuel sources, and so it just doesn't take as long. We want to use these PREs 3 to 4 times a week if possible, and we want to increase resistance or sets and reps gradually. We can do up to about 10% of the original starting total if we're able to finish the reps in a set. So say for instance, if I did 100 pounds for leg press 1 week and I finished all the reps in my set and that kind of felt easy, or maybe even moderate, then I can increase that to 110 pounds next time I try it. We don't want to just keep increasing reps and reps and reps. We run into that sometimes in the physical therapy clinic that I work at because we have maintenance members who are allowed to come in and work on their own. And I've run into a couple who are doing 50 repetitions. And to them I say, please increase your weight and drop your repetitions. Because if we're getting to 50 repetitions, it's just only endurance. It's almost like riding a bike. It's not even increasing their strength at all. And we want to make sure we're increasing both endurance and strength if we're looking at a rehab setting. Circuit training is another type of training we can use primarily in a fitness setting. So this is popular in some gyms such as Choose Fitness, where they have a big circuit set up. So basically you use a variety of exercises with little rest between stations. So in this particular example, the person's doing squats and then push-ups and then step-ups and then sit-ups and then up-downs and then chin-ups and then jumps and then back extensions. So at Choose Fitness, there would be like a lat pull down and then a step that you could do work on. And then the next machine would be leg extension, and the next machine would be rows, the next machine would be hamstring curls. So they try to kind of alternate between upper and lower extremity exercises and abdominal work and some cardio work. Because you're not getting rest between stations, this can increase your aerobic fitness somewhat because your heart rate is elevated the entire time. It can also save time because you're alternating upper and lower body exercises, so you don't need to take your rests between sets because the upper body exercise is a rest set for the lower body exercise. The circuit training can include progressive resistance exercises, flexibility, calisthenics, and aerobic exercises. Next, we'll discuss plyometrics. So this particular individual in the picture on the bottom of the slide is showing us a picture of a jump into the air that could be, that's considered a plyometric type of exercise. He's a little awkward with it, and it's frame by frame. So he would be doing this in a very quick motion. So he would get a rapid stretch with his Achilles tendons by going from this position to a greater angle here, and then he would use that stored energy from that rapid stretch to boost himself into the air. Now, the plyometric really depends more on the quickness of the stretch than the amount of stretch. So you'll see he's not, digging in as hard as he can or not bending as low as he can. He's doing a quicker movement to get more explosive power. With plyometrics, you do need a good base of strength and good form to be allowed to do these exercises. So the strength and conditioning, certified strength and conditioning specialist training actually recommends that somebody be able to single leg press their body weight prior to doing plyometric exercises because they are so difficult on your joints. They also set a weight limit for these types of exercises. So linemen really shouldn't be doing plyometric exercises. These are more appropriate for athletes and people who are 200 pounds and less. People who are slightly heavier could do them, but people who are 300 pounds should not be doing an awful lot of jumping on their because of their joint surfaces with their knees and their hips and their back. So we need a good base of strength and good form for these types of exercises. On this slide, we have both calisthenics and functional exercises. Calisthenics can also be called body weight exercises. So we're going to use the body weight and gravity as resistance. So an example of this would be push-ups. So when we look at the push-ups here, we call these regular push-ups, and these are called knee push-ups. They're not called girly push-ups or something to that effect. They're called knee push-ups. But doing the knee push-ups instead of the regular push-ups makes the exercise slightly easier because you actually have gravity is or less weight from gravity is being put on the arms. We're going to use 2 to 3 sets of about 10 reps. Another type of exercise on this slide is the functional exercise. So it's really difficult to see in this picture, but this individual is actually using a band that's coming up from this direction, and then he's pulling that band down. So he's starting high and pulling low, and he's going to keep going to pull that band all the way across. So with this functional exercise, he's using a lot of different planes of motion. So he's coming from high, bringing the band across his body, and going into a low lunge on the other side. So this is going to increase core stabilization and possibly flexibility. This exercise is called a band chop. We're using lots of planes of motion, and we're getting rotational strength as well as that core stability and flexibility there. Okay. When it comes to fitness, aerobic capacity is very important. Injuries often happen when an athlete is tired, so aerobic fitness is also important for prevention of injuries. A lot of times when we're talking about aerobic capacity, we use max heart rate. Max heart rate is used to estimate VO2 max. So VO2 max is a lab measured aerobic capacity. If somebody was to get their VO2 max measured, you need to wear a special mask that's measuring your oxygen intake and your carbon dioxide output. And usually this is done on a treadmill or a bike. And I can't remember exactly how long it takes, but it takes something like 20 to 30 minutes. And that is actually very accurate. Max heart rate is used to estimate that VO2 max. So when we're doing the max heart rate, we want to take the pulse at the wrist, because when somebody's breathing really hard, taking the pulse at the carotid artery on the neck can be a little difficult. You can mistake breathing for pulse. We also need to take that heart rate within 15 seconds of completing the activity if we want it to be accurate. Once we find that max heart rate, we can actually figure out our target heart rate. So we can use that target heart rate to determine if we're working at a desired exercise intensity, because our heart rate changes with the pace of an activity that we're doing. Target heart rate is helpful if we're trying to train in certain zones or at certain intensity and certain intensities. As far as being in a fat burning zone, like you'll see on some treadmills and ellipticals, I don't personally find that to be necessarily the most helpful thing, because if we're in a fat burning zone, that means we're burning more, we are burning fat, a lot of fat while we're in the exercise, but then after we're done with the exercise, we don't continue to burn fat that much. Whereas if we were to do something more like interval training or higher speed training where we're pushing ourselves a little harder and maybe above what that fat burning zone heart rate would be, then we wouldn't just burn fat while we were exercising. You actually would continue to burn fat for longer after you're done exercising. So a lot of times doing that interval training, you will burn more fat overall than you would if you were exercising in that fat burning zone. But if we're using target heart rate like it's meant to be used as far as trying to exercise at a certain intensity, we're going to take our resting heart rate plus 0.6 times our max heart rate minus our resting heart rate. So an example for a 33-year-old with a resting heart rate of 65 and a max heart rate for that person would be 220 minus 33, which would get 187. And if we're trying to calculate training at a 60% effort, we would use a calculation below. So the max heart rate at 220 is a constant. Minus 33 is you subtract your age from that, and that would be your max suggested heart rate for your age. So target heart rate for 60% effort would be 65 for the resting heart rate plus 0.6 times 187, so that would be the max heart rate for a 33-year-old, minus the resting heart rate of 65. So the target heart rate for 60% effort would be 132. There are a few different types of aerobic exercise. We have continuous training, so that would be long, slow, maybe like a 1.0 ramp on the treadmill, doing the same speed the entire time, running for about 20 to 60 minutes. That would be one example. We want to sustain 60 to 80% of max heart rate for that continuous training. So again, running on a treadmill with no ramp or 1.0 ramp would be closer to running outside. Interval training is more sport specific and structured. So with interval training, you'll have periods of intense work and then relative rest periods. So somebody might be doing 80% effort run and then a 30 to 45% effort walk or jog. So an example of this would be 10 to 20 second sprints within a 60-second rest walking. When I was in college covering football practice, I always used to think it was funny that when I watched track at the same time when they were next door, that these guys would sprint and then they just spend a bunch of time walking. And I kind of thought it was funny that they were having such short efforts, basically, and they didn't seem to really be working all that hard. But realistically, that was a part of their workout. They were doing the walking to recover from the sprints. So they were doing interval training. Fartlek training is unstructured, and that's a little bit more what most of us would do if we're running naturally outside. So we're going to have varying terrain and intensity, and it'd be like running outside in a neighborhood. So you're out for a jog and you're running along, and then, all of a sudden there's a dog that's chasing you, so you have to kind of sprint away from the dog, and then you're jogging along again, and there's a hill, so you're kind of running uphill and then downhill. And then maybe you want to push yourself to get through a street light, so you run a little harder to get to the street light. So you're doing varying train in intensity, but it's not as structured as the interval training. The interval training is specific periods of time that we're running for and then resting for. Fartlek training is more unstructured. We should do cardio at least 3 days a week to see improvements. And that is the end of our fitness lecture.